Morgan. I'll be your student nurse today. Could you please confirm your name and date of birth for me, please?
Reynaldo Gonzalez, October 7th, 1985.
All right, let me just double check your bracelet. Okay, awesome. So today what we're going to do is we're going to run through a couple of different assessments. We're going to do respiratory, cardiac, and abdominal, so gastrointestinal with your stomach. It's going to take no more than 15 minutes. Sound good?
Sounds good.
All right, awesome. So the first thing that we're going to do is the respiratory system. And I'm going to start just by asking you a couple of questions. So do you have any history, like in your family, of lung disease?
Lung disease, no.
And you yourself, have you had any lung issues, like asthma diagnoses? No? You experienced any symptoms lately, any coughing, shortness of breath, or chest pain?
No.
No? Okay. And do you have any smoking history?
I smoke a cigar a few times a month.
All right, so not like a regular habit, but just like how many cigars when you do?
Maybe 2 a month.
All right, 2 a month. And have you had any jobs where you had like environmental exposure to chemicals or something that you'd be inhaling?
Yes. I was in the military for 8 years, so I inhaled a couple different things.
Okay, so military for 8 years. All right, so I'll definitely make a note of that too. Have you had any flu or COVID vaccinations?
I've had all 3, well, 2 COVID vaccinations and then the booster.
Okay. While I was talking with the patient, I was visualizing his breathing patterns. So he's breathing fairly easily, no exerted effort, not using any accessory muscles to breathe. So normal breathing pattern, chest expansion as expected. Looking at his face, I see the color is appropriate for ethnicity, no signs of cyanosis or anything in the lips. So he appears to be oxygenated well. The diameter here is as expected, no signs of barrel chest, and again, he's not having any issues breathing, so I'm not concerned for any long-term effects there. So if I could just have you face away from me, so I could just take a look at your back. So now I'm going to assess your posterior thorax, so could you just please take a deep breath in, all right, and out. Okay, so symmetrical expansion on the posterior thorax, as expected. And next I'm just gonna take a listen to your lungs. So in the clinical setting, usually our patients would have a gown on, so I would do directly to skin, but to protect my patient's modesty here, he's gonna keep his shirt on. But starting at the apices of the lungs and using the diaphragm of my stethoscope, I'm gonna start and do a group keep pattern. So could you take another deep breath in and out? Okay. All right, same thing, please. All right, and another. One more. And if you feel lightheaded at all, just let me know. Just only breathe as you feel comfortable. All right, we're gonna do a couple more. And now I'm gonna start doing some lateral sounds, so if you could breathe in again. And out. Okay. Another one for me. One more, please. All right, and last one. Okay, great. So your lung sounds are normal and clear. There was no signs of any crackles or something that we would expect if you had any like fluid in your lung. That should be good when we're all set for the respiratory. Next, we're gonna do the cardiac assessment. So just have another couple set of questions for you. Do you have any recent or in the past couple months, any chest pain or difficulty breathing or noticing any differences in pain, breathing patterns?
No.
No? Okay, great. Do you have any family history or history yourself of cardiac issues?
Yes, I have family history. My dad's had multiple heart attacks, triple bypass, couple of stints. My grandfather had a 6 bypass, if I remember correctly, and also a couple stents put in. My mom has a leaky valve, and then the rest I can't remember anymore.
Okay, so definitely history on both sides, so we want to be on the lookout for anything that could come up. Have you noticed any lymph node enlargements, maybe like in your armpits, on your neck, there's some in your groin, so on either side?
Just when I had a real bad sunburn.
Okay, so and you noticed it once the sunburn cleared up, that went away?
Yeah.
Okay, great. Are you on any medications for your heart or anything that you've noticed might affect any feeling of like lightheadedness, blood pressure?
Not that I've noticed.
Okay, great. And you said that you have a couple cigars every once in a while, so for smoking history, that's all you really have?
Yeah.
Okay, great. So next we're moving on to just the actual assessment part of that. Taking a look at your extremities, I'm not seeing any signs of edema. Everything looks good there. So looking at the chest wall, the contour appears normal. Not seeing any issues with that. I'm gonna palpate your carotid arteries, is that okay? Okay, so I'm gonna do each one at a time, but just to make sure that it's there. Okay, that one's good. Okay, perfect. And now I'm also just gonna listen to it really quick. So changing my stethoscope to use the bell. Okay. Could you just take a deep breath in, exhale, and then hold it for me? Okay, great. And you can breathe, and I'll do the other one. Don't want you passing out. Okay, awesome. So everything sounds good. No sign of bruise, which basically would mean that you have like turbulent blood flow. So sounds good, and you're carotid. So next what we're gonna do is take a look at your pulses. So I'm gonna do your radial and the one on your foot. So if I can see your hand, please. All right. Okay, so pulse feels normal amplitude. I rate that about a 2+. Your pulse is a little fast, but not anything crazy. And then I'll feel here too as well. All right, so definitely can feel both the radial and the dorsalis pedis pulse. And the rhythm normal, so no issues there. Okay, so next I'm gonna take a look at your hands and just look for capillary refill. So I'm just gonna pinch your nails a little bit. All right, so on this hand, under 3 seconds. Same thing here, and then I'm gonna look at your toes if that's all right. So this foot, refilling in about 2 seconds or less than, and this one, same thing. So no issues with capillary. I'm going to have you lay down, put your feet up on this side. I'm gonna have to take a look at your left side. Tilt yourself a little towards the left. So I'm gonna be feeling your apical pulse, which is your point of maximum impulse. So that's gonna be on the along the midclavicular line, about like your 4th or 5th intercostal space. So to you, that doesn't mean much, but verbalizing here. So that's gonna be right about here. Yeah, good job, bud. You found it too. Come on. Bingo. Good boy. Okay, so no sign of lifts or heaves. Proper body mechanics. I got down to my patient's level. And I'm just going to auscultate that as well with the bell of my stethoscope. And again, in the clinical setting, I would be doing this on skin, but to preserve some modesty, I will just allow this. All right, so heart sounds sound good at the point of maximum impulse. So next what we're gonna do is listen to several different points. So this is gonna be the 5 most prominent, I guess you could say, points for your impulses or for your listening to your heart. So to find the aortic site, I'm going to be looking at the right sternal border at the 2nd intercostal space. So that's going to be, here's the sternum, so right sternal border, and the 2nd intercostal space will be about here. So I'm just going to take a listen to that first, using the diaphragm. All right, you have a heartbeat. Okay, so next I'm going to be looking at the pulmonic site. So that's going to be the left sternal border, same thing, 2nd intercostal space, so right about here. Okay, great. So next we're going to listen to Erb's point. Erb's point is the left sternal border and the 3rd intercostal space, so I will be going here. Okay, great. And last, or actually next we're going to be listening to the tricuspid, which is the left sternal border, 4th intercostal space, so that's a little bit lower. And lastly, the mitral site, so that is the 5th intercostal space and the midclavicular line. So that's going to be okay. Perfect. Your heart sounds good. There was no abnormal sounds. You have your S1, S2, which is that lub dub that we expect. All right, perfect. So that's it for cardiac. All right, so next we're going to move on to your abdominal assessment and just kind of get a better sense into how your gastrointestinal system, your stomach is doing. So do you have any changes recently in your appetite at all?
No.
All right, no changes. Have you had any issues swallowing or like with the actual eating process?
No.
No? Do you have food intolerances or allergies?
No.
No? All right. Have you had any abdominal pain, nausea, vomiting?
I have IBS, and that tends to give me some.
Okay, so you have IBS. Is that specific to like when you have like a stressful situation, or is there anything else that might trigger it?
Combination of things.
Combination. So stress.
Stress
being
is
one
probably
of them?
the main thing.
Okay, stress main thing. So what are your normal bowel habits? When would you say like how many times a day, or if it not every day, like how often?
At least once a day. Sometimes, depending if I'm having a bad day, I could have 4 or 5 a day.
Okay. And you would say that's not like a normal day, but that's when you do
That's
notice.
not a normal day.
Okay.
Normal day would be 1 to 2.
1 to 2. All right. Have you had any abdominal surgeries?
No.
No. All right. Are you on any medications that for your IBS or anything that you take to treat that?
Not medications. Just over-the-counter probiotics.
Probiotics. All right. Great. And just for like a quick nutritional assessment, could you rattle off maybe like what you've had to eat the past 24 hours?
Past 24 hours, a BLTE, bacon, lettuce, tomato, and egg, and that was breakfast. And then dinner was tacos.
Tacos? All right. Did you have any drinks like water,
Had
soda, coffee?
some water and coffee this morning, 2 beers, soda, and about 40 to 60 ounces of water.
All right, 40 to 60 ounces of water. Nice. And did you have any snacks throughout the day at all?
No.
Okay. Well, that's perfect. Thank you for that. So next what I'm going to do is I'll have you lie down again, and if you could just expose your abdomen, and I'll look around a bit. Okay. Perfect. And I'll come around to you this way. Okay, so first thing, I'm just taking a look at the abdomen, and the contour is normal. I don't see any distension. Skin appears smooth. I don't see any issues with skin integrity or abrasions, lesions. So the first thing I'm going to do is I'm going to auscultate your bowel sounds. So I'm going to go over here and starting with your right lower quadrant, going to the right upper, and then left lower. Okay, so you definitely have present bowel sounds, which is good. That would be a problem if we didn't hear anything. I would definitely term those as normal. It wasn't too many or hypoactive, meaning that there's not, they're barely there type of thing. So next what I'm going to be doing is I'm going to palpate the same areas there. So I'm going to do it first lightly with one hand, and then I'll go a little harder with 2 hands afterwards. Just let me know if you feel any tenderness while I'm doing that. Okay, so first with the one hand. Everything feel okay? Any tenderness?
All good.
Okay, and I'm just gonna go a little. Okay, so no signs of the patient guarding, so no signs of discomfort, and I did not feel for any masses, or I didn't actually feel any masses. What I'm going to do is I will be listening to your aorta, so you have an abdominal aorta, so I'm just going to listen to that with the bell of my stethoscope. So that's going to be found about 2/3 between your belly button and the bottom of your sternum, which is called the xiphoid process. So I'm just going to turn that, and then I would say about right here. Okay, so definitely normal sounds. I'm not hearing anything out of the ordinary. And that should be it for your abdominal assessment. You can sit up now if you'd like. But thank you so much for, complying with everything. Everything seems good. I have nothing that's concerning, but I'll definitely bring everything up with the provider. And then they'll be in to chat with you on anything.
Awesome.
All right, well, have a
Thank
great
you.
day. Yeah.